Hi, welcome to today's lecture on abdominal radiograph interpretation, a systematic approach. I'm Dr. Vet Imaging, and this session is brought to you by Vet Imaging Lab. Before we start, let me ask you something. Have you ever looked at an abdominal radiograph and thought, where do I even begin? Or, what if I miss something important? Well, don't worry. By the end of this lecture, you'll have a structured, reliable method to interpret abdominal radiographs with confidence. Let's dive right in. When analyzing an abdominal radiograph, we need to focus on 5 key factors: size, shape, density, margins, and location. These characteristics help us distinguish normal structures from abnormalities. To ensure a complete and accurate interpretation, we'll follow a 5-step process. First, we need to check the image quality before making any interpretations. No matter how experienced you are, a poorly positioned or overexposed radiograph can lead to serious misdiagnoses. Next, we carefully examine the abdominal borders, including the diaphragm, abdominal wall, and pelvic structures. These areas define the limits of the abdomen, and any abnormalities here can indicate significant pathology. Then, we assess intra-abdominal density. Can we clearly see the serosal detail? Is there peritoneal effusion or a lack of fat? Recognizing these density variations is crucial in determining normal versus abnormal findings. After that, we evaluate the abdominal viscera, checking each organ for position, size, and structure. Finally, we identify focal abnormalities, particularly looking for mass effect. If a mass is present, the most important question is, which organs are being displaced? This will give us a clue about the origin of the mass. By following these 5 steps, we can ensure that our interpretations are systematic, accurate, and reliable. All right, let's move on to step 1. Before we start analyzing the radiograph itself, we need to make sure that the image quality is good enough for interpretation. First, proper positioning is critical to avoid misinterpretations. In a lateral view, the rib heads should be superimposed, meaning they should overlap perfectly. Take a look at these images. The one on the left shows proper positioning, while the one on the right has rotation. Can you see the difference? In a ventrodorsal view, the spinous processes should be centered. If they appear off to one side, the patient is rotated, and the radiograph won't be accurate. And most importantly, the thorax and abdomen should be symmetrical to avoid distortion. Next, we need to check the exposure and contrast of the image. If the radiograph is overexposed, soft tissue structures will appear too faint, making it hard to evaluate organ details. If it's underexposed, everything will look too white, and we won't be able to differentiate between soft tissues. Finally, we need to confirm that the entire abdomen is included in the image. A good radiograph should show everything, from the diaphragm to the pelvis. If part of the abdomen is cut off, we might miss an important finding. So remember, before you even start interpreting a radiograph, check the positioning, exposure, and field of view. A high-quality image is the first step to an accurate diagnosis. The step 2 is to examine the abdominal borders. When we talk about abdominal borders, we are referring to key anatomical structures that define the outer limits of the abdomen. First, the diaphragm is a critical landmark. A normal diaphragm should have a clear, continuous outline. If you see any disruption, it could indicate conditions like a diaphragmatic hernia or a mass pressing against it. Next, the abdominal wall musculature should be smooth and intact. Any bulging, irregularity, or gas accumulation in the subcutaneous layer could suggest issues like hernia or trauma-related rupture. The vertebrae and sublumbar region should be checked for abnormalities like soft tissue masses or bony changes that could indicate metastasis or lymphadenopathy. Finally, the pelvic area is important, especially in cases of rectal or perineal hernias. These can lead to displacement of abdominal contents into the perineal region, which we'll discuss in more detail later. So remember, before moving on to evaluating internal organs, always check the abdominal borders first. This will help you detect major structural abnormalities early on. Now, let's focus on the diaphragm in more detail. Take a look at this radiograph of a dog having peritoneo-pericardial diaphragmatic hernia, or PPDH. PPDH is a congenital defect where the diaphragm doesn't fully close, allowing abdominal organs to move into the pericardial sac. You can see here typical PPDH findings. First, loss of diaphragmatic continuity. Normally, the diaphragm should have a smooth, well-defined outline. In PPDH, you may see a disruption or an indistinct margin. Do you see the red arrow here? It's pointing to the area where the diaphragm has a gap. Second, abdominal organs appearing in the thoracic cavity. You might see the liver, intestines, or other abdominal structures within the pericardial space. Finally, enlarged cardiac silhouette. Since abdominal organs are displacing the heart, it can appear abnormally large or have an unusual shape. Let me ask you a question. How do we differentiate PPDH from traumatic diaphragmatic hernia? PPDH is congenital, meaning there's no history of trauma. In traumatic hernias, we often see pleural effusion and lung collapse due to recent injury. So, whenever you suspect a diaphragmatic abnormality, always ask, is this a congenital defect, or could it be trauma-related? Now let's check the pelvic region. Take a look at this image. Can you see the abnormal bulging marked using boule arrows in the perineal region? This is a typical radiography of a dog with a perineal hernia. Perineal hernias occur when the pelvic diaphragm muscles weaken, allowing abdominal contents such as the rectum, bladder, or intestines to herniate into the perineal region. This condition is most commonly seen in older, intact male dogs due to hormone-related muscle atrophy. Here's what to look for when diagnosing a perineal hernia: unilateral or bilateral perineal bulging. The swelling can appear on one or both sides of the anus, depending on the severity. Displacement of abdominal organs. In severe cases, the bladder or intestines may herniate into the perineal area, which can cause straining, constipation, or urinary obstruction. Loss of normal pelvic diaphragm support. Compare the affected side to the normal side. There's usually an obvious asymmetry. Let's move to step 3, assess intra-abdominal density. This is where we determine whether the abdominal structures have good serosal detail or if something is affecting their visibility. Serosal detail refers to how clearly we can see the margins of abdominal organs on a radiograph. When serosal detail is good, the organs are well-defined and easy to distinguish. But when it's poor, the abdominal structures appear hazy or obscured. Abdominal fat plays a major role in determining serosal detail on radiographs. Fat within the abdomen is organized into different compartments that help create contrast between organs, making them easier to distinguish. Take a look at this image. Each colored section represents a different fat compartment. The omentum, highlighted in blue, is a large fatty structure that extends from the stomach and covers the intestines. It helps improve contrast in the cranioventral abdomen. The mesentery, shown in red, contains fat that surrounds and suspends the intestines. Well-developed mesenteric fat enhances the ability to separate individual intestinal loops. The retroperitoneal space, marked in yellow, is located behind the peritoneal cavity surrounding the kidneys and major vessels. If a patient has very little fat here, the kidneys may blend into the surrounding soft tissue, making them harder to evaluate. And finally, the pericolic fat, shown in orange, is located around the colon. This fat helps define the large intestine. Now, look at the image again. Can you see how these fat compartments outline the abdominal organs? Without enough fat, the abdominal organs appear hazy, making it difficult to differentiate structures. Now, here's something interesting. Did you know that cats generally have better serosal detail than dogs? This is an important factor to consider when interpreting abdominal radiographs, because species differences can affect visibility. Take a look at these images. The radiograph on the left is from a dog, and the one on the right is from a cat. Can you see how the cat's abdominal organs are more clearly defined? Cats naturally have more evenly distributed intra-abdominal fat, which helps create better contrast between organs. Now, let's take a closer look at these radiographs. Both of these images are from cats. In both images, the serosal detail is excellent, allowing us to clearly distinguish the margins of the abdominal structures. On the left, look at the sublumbar region, how the fat in the retroperitoneal space helps separate the structures, making it easy to visualize the kidneys and large vessels. On the right, you can also see the abdominal wall musculature, clearly outlined. This is a great example of why cats typically have better serosal detail than dogs. All right, now that we understand the role of fat in serosal detail, let's move on to what happens when serosal detail is decreased due to fat deficiency. Look at these images. The one on the left shows clear serosal detail, while the one on the right has reduced visibility. Can you see the difference? There are two main reasons for decreased serosal detail. First, lack of abdominal fat. Young animals, emaciated patients, or animals with low body fat may have poor serosal detail simply because there isn't enough intra-abdominal fat to provide contrast. This is a normal variation, but it can make it harder to evaluate certain conditions. In these images, we can see the difference of serosal detail in the abdomen between normal cat and the emaciated dog. In the emaciated dog, we can't see the serosal margin of the intestines. Next, the second reason for decreased serosal detail is peritoneal effusion. The presence of fluid in the peritoneal cavity, such as ascites, hemorrhage, or peritonitis, can also obscure serosal detail. Unlike fat deficiency, which results in gradually reduced contrast, fluid tends to cause a more uniform soft tissue opacity, making all abdominal structures look hazy, like this dog having a large amount of peritoneal fluid. So, remember, if serosal detail is poor, the first question you should ask is this due to a normal lack of fat, or is there an underlying pathological process, like effusion? Let's move to step 4, evaluate the abdominal viscera. In radiograph, the liver, spleen, stomach, intestines, kidneys, and bladder are structures that should be normally visible. Each organ should be evaluated based on opacity, size, big or small, shape, smooth and well-defined, or irregular and distorted, position, and number. But not all abdominal organs are visible on radiographs. The pancreas, adrenal glands, lymph nodes, gallbladder, and ureters are typically not seen unless they are enlarged or affected by disease. Since we can't directly visualize them, we have to rely on secondary changes, such as displacement of adjacent organs, increased soft tissue opacity, or abnormal gas patterns, to infer pathology in these hidden structures. Or we have to use other imaging modalities with higher sensitivity for soft tissue organs, such as ultrasound or CT. Now let's move on to the final step of our systematic approach, identifying focal abnormalities, particularly mass effect. Understanding how a mass affects the surrounding organs is key to determining its origin. Mass effect occurs when an abnormal structure, such as a tumor, cyst, or organ enlargement, pushes or displaces adjacent organs. Instead of focusing only on the mass itself, we need to analyze which normal structures have shifted. This will give us clues about where the mass is coming from. To interpret the mass effect, let's divide the abdomen into 3 regions: the cranial abdomen, mid-abdomen, and caudal abdomen. Understanding mass effect in these different regions helps us localize pathology more accurately. If a mass is present in the cranial abdomen, it often originates from the liver or stomach. For example, hepatomegaly can push the stomach caudally, while gastric dilation can cause the stomach to expand abnormally. In the mid-abdomen, mass effect may indicate abnormalities in the spleen or intestines. A splenic mass can displace the intestines dorsally or laterally, while intestinal distension from obstruction can cause displacement of adjacent loops. In the caudal abdomen, the most common causes of mass effect are prostatic or uterine enlargement. An enlarged prostate can elevate the colon dorsally, while a distended uterus in a pregnant or pyometra-affected dog can shift the intestines cranially. Notice the retroperitoneal space marked on the image. If a mass is affecting this area, it could be originating from the kidneys, adrenal glands, or sublumbar lymph nodes, pushing adjacent structures ventrally. By systematically analyzing which organs are displaced and in what direction, we can infer the likely source of the mass, even if the abnormality itself is not well defined. Take a look at some examples. In this case, which organs are being displaced? The stomach and intestines are pushed caudally. As you can see in this case, the mass is likely coming from the cranial abdomen, possibly the liver. Another example. On both the lateral and ventrodorsal views, you can see a mid-abdominal mass occupying a large portion of the abdominal cavity. As a result, the surrounding organs are displaced. The intestines are pushed laterally and caudally, which is a typical pattern, when a mass originates from the spleen. Let's see these two radiographs show different degrees of prostatomegaly. The image on the left represents mild prostatic enlargement, while the one on the right shows marked prostatomegaly. As the prostate enlarges, it displaces the bladder cranially. In the more advanced case on the right, the bladder is pushed even further forward, and the prostate appears more prominent. Here's an example of mass effect caused by uterine enlargement in the caudal abdomen. These radiographs show a markedly enlarged uterus, which is pushing the intestines dorsally. This type of displacement is a key indicator of an abnormal uterine condition, such as pregnancy or pyometra. When assessing a caudal abdominal mass effect, consider the patient's history. In an intact female, an enlarged uterus should always raise suspicion for conditions. Before we wrap up, let's go over a quick checklist to help reinforce the systematic approach we've discussed. When interpreting abdominal radiographs, following these 5 key steps will ensure accuracy and consistency. First, always start by checking image quality. Make sure the positioning, exposure, and field of view are correct, because a poor quality radiograph can lead to misinterpretations. Next, evaluate the abdominal borders. Carefully examine the diaphragm, musculature, pelvic region, and peritoneal lining to detect any structural abnormalities. Then assess intra-abdominal density. Determine whether serosal detail is adequate, and differentiate between fat deficiency and peritoneal effusion, which can both reduce visibility. After that, analyze the abdominal viscera. Compare visible and non-visible organs, and systematically evaluate each structure for changes in density, shape, size, number, and location. That concludes our lecture. Thank you for watching, and I hope this helps in your clinical practice. This has been Vet Image Lab, and I'll see you in the next session.